Welcome back, everyone. After Buffalo Bills safety Damar Hamlin collapsed on the field after a tackle on Monday night's NFL game, he remains in critical condition.
So Hamlin suffered from cardiac arrest, and Dr. Kent Meredith, a cardiologist at Intermountain Health, on the show today to talk about how this could have happened. So you're watching video. That's Monday night's game between the Buffalo Bills and the Cincinnati Bengals, and that Bills safety, Damar Hamlin, collapsing on the field there. You see the team like shielding him, all gathered around on a knee. He experienced cardiac arrest. They started CPR on the field. Doctor, what is that? Let's do the basics. What exactly is cardiac arrest?
Yeah, that's such a tragedy, and for such a young man who's got his life ahead of him. Whenever we see this, obviously our hearts go out to the players and the families and the team members. But this is a situation where the heart stops beating suddenly, and there's no warning for this. The heart simply stops contracting, and so it's not able to pump blood. And obviously, when that happens, there's no survival unless you can get in there immediately and react and try to resuscitate the heart.
But he stood up and then collapsed again.
Yeah. So
does that surprise you?
Well, it just depends on when the event happens. What we see when we're in a medical scenario and we see cardiac arrest, there is often a brief period, maybe a second or two, where there's still some alertness or consciousness, but it very quickly is gone when the heart stops pumping.
And Dr. Meredith, we know that you did not help this patient. You have no connection.
Right.
We'll be clear about that. But a lot of people are talking about this condition called commotio cordis.
Yes.
And what exactly is that? And it's incredibly rare, right?
Right, that's correct. So commotio cordis is one of the possible causes of cardiac arrest for young athletes. It's important to stress here that we really don't have a definitive diagnosis or cause in this situation, but it certainly is one of the possibilities, and there are some features about what happened on the field that night that could have explained the cardiac arrest. Commotio cordis is referring to a situation where the athlete or the patient suffers a high velocity impact to the chest. Usually it's a small projectile like a baseball or a hockey puck that hits the chest in the exact position and at the very wrong timing so that it can set off an arrhythmia, which then leads to the heart arresting or not pumping blood anymore. It's, as you said, it's very rare. There are other things that can cause cardiac arrest in young athletes, and so it's important not to jump to conclusion. I know around the water coolers around the United States today and yesterday, everyone is talking about this condition. But there are other things that are probably as likely to cause cardiac arrest in a young athlete.
So let's talk about that for a second. How often are you seeing young adults go into cardiac arrest, and are there warning signs?
Fortunately, not often. This is very, very, very rare. Unfortunately, there are not usually warning signs for cardiac arrest. So this is one of the problems, is that unless you have a family history or some other risk marker, it's very difficult to predict which patients are going to be likely to have cardiac arrest. For a lot of organized sports, they do screen athletes. Many times in school organized sports, you have a requirement to see a doctor and have a pre-sports physical. But even that is limited in what it can pick up in terms of the risk of this happening.
What was so remarkable about what happened on Monday was that within a few seconds, there were cardiologists, paramedics right there giving CPR. There's a team, thankfully, right there on the field who train day in, day out for this type of situation. How critical is it to have someone and to address the issue right then and there, to have defibrillators, to do CPR?
Absolutely. It is the critical factor in this. You know, survival from cardiac arrest used to be very, very poor, almost zero. But with the technology that's now available with AEDs that are available in many public facilities like a stadium or
shopping mall,
yeah,
in
shopping
our
mall,
office. Yeah.
dance theater. These instruments have really made a big difference. Now, survival from cardiac arrest, if you have a quick response with a team that has an AED and they come in and they start CPR immediately, the survival is actually reasonable. It's still not great, and we've got a long way to go, but compared to where we were 20 years ago or 30 years ago, there's much more hope now.
Is that your message? No CPR?
That,
know what to do when this happens?
Actually, I was gonna say, if you are a parent of a young athlete or you are a young athlete, really you want to encourage everyone to learn CPR. I mean, everyone in the public should learn CPR, because if you're even a spectator in the stands, you could jump in and help out in a situation like this. Maybe not at an NFL game, but if you're just, in the local park watching your kid's soccer game and one of the athletes, collapses on the field, if there are a number of people around that know CPR and that can immediately rush out and start, that's the first step. You've got to do chest compressions. That keeps the blood circulating to the brain long enough.
Open that airwave. Mm-hmm.
Well, even more, the chest compressions, that's keeping the circulation going. That's keeping the brain alive, which really, if you don't start that within a matter of seconds, the brain starts to die. And
that saved his life on the field.
It saved his life and gave him a chance of recovering, hopefully. And then, of course, you call for help immediately, and anyone available who could get to an AED, they rush in, they set that up, they push the on button, and then follow the instructions. That's the beauty of it, is they're designed for anyone to just be able to turn the button on, and they will speak to you, the AED will speak to you and give you instructions and tell you how to proceed from there.
Well, we wish the best for Damar Hamlin,
Absolutely.
and thank you, Dr. Meredith, with Intermountain Health, for that incredible information.
You're very welcome.
We'll be right back.